Millions of Canadians may soon be rolling up their sleeves yet again. Health Canada has approved an updated COVID vaccine, a bivalent shot. Dr. Supriya Sharma is the Chief Medical Advisor at Health Canada.
Essentially 2 vaccines in one. Health Canada's decision to authorize this new bivalent vaccine was based on data from a clinical trial that showed that a booster dose of the bivalent Moderna vaccine triggers a strong immune response against both the Omicron BA.1 and the original SARS-CoV-2 virus strains. While the vaccine was designed to more specifically target the Omicron BA.1 subvariant, we know that this vaccine also generates a good immune response against the Omicron subvariants BA.4 and BA.5 that have more recently emerged.
Now, the shot's approval comes as some experts are warning about a surge in cases this fall. Peter Cowan is on this story for us live from Ottawa. So, Peter, what more have we learned about this updated vaccine?
We know that there are 12 million doses that the federal government has ordered from Moderna of this new version of the vaccine. It's 2-in-1, so you still get that protection that's similar to the original shots that we've been using so far for the first, second, third, and sometimes fourth doses, but then is also going to be a little more tailored to the type of COVID that we're seeing now, which is the Omicron variant. Interestingly, in the United States, they're skipping over this version of the vaccine because it's tailored to the original Omicron, BA.1. Now what we're seeing is BA.4, BA.5 is circulating, the U.S. wanting a more updated vaccine. Canada's approach is, well, let's get this one into circulation, then we're going to take a closer look at this latest version. We don't even know if the one more tailored to the new variants is actually going to be any better. Dr. Howard New said that Canada's approach is the same one that other countries in Europe, for example, are taking.
And who knows what the next subvariant maybe of Omicron or a completely new a variant that might emerge in the coming days, weeks, or months. Those are things that you have to take into consideration in terms of, hey, what do you have in hand versus, thinking of what might, quote, potentially happen in the future. So I think at the end of the day, we're very comfortable with the fact we have a good bivalent vaccine. And the fact is that, as we've said at the get-go, if it's been over 6 months since your last, vaccine dose and or infection, definitely go out and get a booster dose.
Now, it is going to take a while for these doses to arrive at the federal government, be shipped onto the provinces. Ontario has already said that within a week or so, they expect to receive their first doses, but they're going to save them for the most vulnerable, so like people in long-term care homes, for example. So it may be a while before the sort of more general clinics have access to this vaccine, but the advice from health officials was you don't necessarily wait. It's going to take a couple of weeks for you to get that protection, so get whichever shot is available.
In terms also of the healthcare system, we know that certainly we've seen a lot of pressure on the system across the country. What did we hear at the briefing about how important it is for the healthcare system for people to get this shot?
It's interesting. We've been talking about fourth doses for people who want to be able to get a shot. But in Canada right now, there's still about half of the population that could get a third dose but hasn't. And so that's concerning for doctors who are looking at the fall, looking at the prevalence of COVID and an expected uptick in cases that we're likely to see. Dr. Lisa Barrett is an infectious diseases doctor, and she says that she's worried that if more people don't get that extra protection, that the hospital system is going to be in a bad place.
We don't have capacity in the fall for, number one, a lot of people to get very sick, or even a lot of people to get moderately sick and not be available to look after and care for their family, or for healthcare workers to be sick. So I am worried that if we do not see people for both their own personal protection and for population protection going and getting vaccine boosters if they need them, I am worried that we are going to see more severe disease, more deaths.
The good news is that whether or not you're getting a shot of the original vaccine that we have been using or the new bivalent vaccine, they're both expected to provide excellent protection from severe disease or death. And that's what the healthcare system is most concerned about, is trying to keep people so that if they get COVID, that at least it's not severe enough that they need help from the healthcare system in order to be able to manage.
Thanks for the latest on this, Peter. That is the CBC's Peter Cowan in Ottawa.